Good morning, everyone, and welcome to day 2 of your hospital orientation here at Jackson Memorial Hospital. My name is Tanika Knowles, and I'm going to be with you today, and we're basically going to be discussing gender-based medicine. I see that we have a mixture of respiratory therapists, nurses, doctors, and also some nursing assistants. This particular part of this orientation session is going to be very helpful for you because you are bedside and you will be dealing directly with patients. I just have a question for you guys. Does anyone know the difference between sex and gender? Oh, I see a couple of puzzled faces. Like, why is she asking me that? Of course we do. Okay, well, I'm just going to give you a brief summary of what it is. In short, sex is about your body, your sexual anatomy, whereas your gender is how you feel about yourself. Whether you refer to yourself as a boy or a man or a girl or a woman. And also, sexual orientation is about whom you're sexually attracted to. Let's start off by discussing how would you deal if you were to enter a patient's room and biologically they identify themselves as an opposite gender. And I'm going to go ahead and give you a scenario, okay? We have a woman that presents to the healthcare provider given a female name, but she shows her driver's license and it indicates that she is really, her gender is a male. When this happens, a lot of times, staff members are caught off guard. Some will understand that she is a transgender female, but they will start to ask each other which name and gender pronouns should they address this patient by, whether they should put her legal name, being a male, or her preferred name as a female. And they're referring to basically what should they put in the medical records, okay? And as far as the armband as well. Whether they ask the patient her biological sex, if it's relevant to her diagnostic or treatment, and also how they should refer to the patient medical records. I mean, these are very hard and difficult things for you to actually think of, like, oh my God, what do I do? How should I approach this? How should we as a staff handle this patient? And when things like this happen, it could be very obvious to the patient, which could make them feel uncomfortable and having to reassure the staff on how to deal with them, which it shouldn't be that way. This is why it's very important to have training available at your facility, which we have it here, to help you and your staff and whatever unit you're on deal with these patients better, okay? Let's see here. Let's see what we could do. There's a lot of different guidelines that we could use and implement in our facilities. I think the best way to deal with this, or suggested way that we think everybody should deal with this, would be to list their legal names and their preferred name on registration and other documents in the medical record. We need to create a way to capture the patient's preferred pronouns and ensuring that those preferred pronouns are used. So basically we need to make sure that in report we relay to whomever is coming on that, listen, this is a woman, but her gender is a male, but this is how she would like for us to address her and what she would like for us to put in her medical records. I think having educational materials either in the computer system, which we do have, or having little pamphlets available in the office for any newcomers or anyone that still might be confused about how to go about addressing this will be very helpful to make the patient feel comfortable and also to make your staff feel comfortable as well. And this is why we are now addressing these issues in our new orientation, just to have you aware of it so you won't be caught off guard and you'll know how to deal with patients such as these when they come to your facility. Another thing that I would like to address with you guys is how we treat male and female patients as far as medically. We as healthcare providers are to meet the needs of both women and men. And when I say meet the needs, we cannot, for example, there are studies that have been done on men. And those same studies they have taken and they've literally treated women with the end results of these studies, which to me is impossible. If you think about it, that's basically doing a study on a dog and using the results of that studies to treat a dog and a cat. They're basically two different types of animals. So there's no way for you to do a research on a woman or a man, for this example, and use the results of that study to treat a woman. All healthcare providers, such as doctors, nurses, respiratory therapists, we strive to provide the best possible care. But in order to achieve this, we must educate current, which is you guys, and future healthcare providers to consider each patient's uniqueness. This is basically the uniqueness of a man and a woman in taking care of, in taking into consideration how sex and gender impacts health and wellness. For example, there's a lot of different diseases that you cannot treat, you cannot give the same medication to a woman as you do to a man, because, for example, woman body, we absorb medications differently. Number one health problem is HIV, AIDS. Also, diseases like TB, autoimmune problems, and especially coronary heart disease. There's no way that we could give the same medications to women as we do to men to treat these diseases. It won't have the same effect at all. So it's very important in this day and age to educate everyone on the difference between the anatomy of a man and a woman and how certain medications will not affect them in the same way. We're going to go more over this throughout the end of the orientation, but that's just to give you a heads up on what to expect and why it's important that we do research and make sure we know that if we're treating a man and a woman with these particular disease, there's no way possible that we could give them the same medication, because it's not going to have the same effects as it would on the other. Another thing I wanted to go over is does anyone have any questions while I'm looking up my files here? Anyone? Okay, good. I'm happy that I'm covering all of the bases for you, that you're understanding what I'm referring to and all of this. Just as a nutshell, it's good to be aware of certain situations, and to treat everyone with respect. I think the key thing in regards to the different genders, sexuality, is about respect, and to be open, use open-ended questions, treat them as if you would like to be treated. And that's what I go by all the time. As far as gender-based care, there's a lot of new research out there. The FDA has approved new guidelines in regards to treating patients when it comes to the different sex. So just read up on all your materials that we've provided for you. Be aware of this. Of course, we will go over this in more details for you in the future. But this, what I just provided to you was just to give you, to open up your mind to all the possibilities, and for you to know that there is a lot of research here that's being done to assist you and also to assist all of our patients that are coming here. If you have any questions, I'll be in the back. You could come and talk to me. But I hope this opened up your mind and gave you just a brief summary of what to expect, okay? Thank you.